Many patients of mine who are in late 30s or 40s and are good candidates for injectables like fillers or neuromodulators say that we are saving it for when we'll turn 50. I tell them that I don't do fillers, especially after 50s, and they're quite surprised or rather shocked to hear it, but let me tell you why. Hi, I'm Dr. Jyoti Gupta, consultant dermatologist practicing in New Delhi, and today I want to tell you my opinion regarding the fillers done after the age of 50. I've been doing fillers for over a decade now, and the most common age group to come for fillers for anti-aging purpose is over 50 years old. And believe me, if you get your lines and folds filled up in this age, it will create unnatural results. Let me give you my top 3 reasons why I don't prefer fillers after 50s. So if you have a skin age of 50 years old, that means you've got fine to medium wrinkles on your face. Your eyes look deeper with under-eye hollows and low-set eyebrows. Your folds have become prominent, majorly nasolabial and marionette lines, and your jowls are showing up. Now this sagging is because of the fat pads displaced from its original position and the ligaments or the pillars holding them together and they become loose. So first reason, if you put fillers in the loose fold, they are going to retain water and eventually will create a downward pressure to these loose ligaments, creating more and more deep midline folds. The solution here is to tighten up your ligaments muscle, that is mass layer, and give anchorage to the falling tissue by lifting them up. This can be done by combining high intensity focus ultrasound or deep threads, which gives a tight flow if required for fillers. Secondly, at this stage, skin elasticity becomes less. Fillers are injected deep and you think of an inflated balloon but covered with the wrinkles. It will neither look natural nor beautiful. You need to work on the upper layer of skin also to make it as smooth as possible, and for that microneedling RF, CO2 laser works wonderfully. If you have some discoloration, then chemical peeling, intense pulse light or laser toning should also be combined to give you natural results. And the third reason is, if you're filling one area, then the other area really stand out at this stage. And if you're doing a pan facial filler, which will require at least 10 ml of filler, then face starts to look voluminous and heavy. There are injectors who will fill the lateral side parts, giving you a lift. But believe me, over a few years, adding too much volume in sides will make your face look broad and definitely unnatural. You can use a pan facial approach with skin biomodulators or skin boosters and maybe PRP, which do not volumize the face but have a bit of filling effect. So to summarize, the deep layers are not tight to hold the fillers where they have been injected. The upper layers are still wrinkly and do not complement the deep filled look. The pan facial treatment can create volume and localized filler can stand out. If you've been working on all these factors, believe me, your skin age is going to be less than 50 and you can definitely plan to go for fillers in first go. But if you've not been working on these factors, my suggestion would be to work on your skin quality first, maybe for a year or up to 5 years, and then think about going for any changes with fillers.